Good morning and welcome to Glaucoma on radio on Solid 100.9 FM. And today we continue to confront a silent but devastating public health crisis, glaucoma, which is a condition often called a thief of sight, silent thief of sight. It creeps in quietly without pain, without early warning, and for many Africans, without a second chance. It's important to put in perspective that Africa carries one of the highest burdens of glaucoma in the world, if not the highest. Studies show that people of African descent are not only more likely to develop glaucoma, but are also more likely to develop it earlier and lose vision faster. Yet awareness remains low, compounding our issue. Screening is not routine. Many only present themselves for screening when vision is already permanently damaged. Glaucoma does not wait, and once vision is lost, it cannot be restored. So today we're asking a very critical question: what must change? Is it awareness? Is it access? Is it policy? Is it affordability? Is it cultural beliefs? Or our personal health seeking behavior? Or is it all of the above? And of course, this morning, joining us is Professor Nkiru Kizo-Akariwe, a leading eye specialist, to help us understand the burden of glaucoma in Africa. And more importantly, what individuals, families, health systems, and governments must begin to do differently. This conversation is not just medical, it is also social, it is economic, because whatever affects your eyes have affected your earning power. It is urgent, and I'm pleased to welcome Professor Nkiru Kizo-Akariwe, who is also the Governor for Africa on the board of Governors of the World Glaucoma Association. Good morning, Prof.
Good morning. Thank you very much. Good morning, our dear listeners.
Okay. I think the situation is that of having a problem and not knowing that you have a problem, having a keg of gunpowder about to go off and you don't even know. And even though you see some people go down with visual impairment, lose their sight, there's not enough awareness to connect what is happening to them to the real situation. So for listeners who may be hearing about glaucoma for the first time, let's start with the basic thing we do, which is, what is glaucoma?
Yeah. Thank you very much. You see, you're a glaucoma ambassador.
Thank you.
We really appreciate it. Now, for our listeners who might not know, who are joining us newly, who might not know what glaucoma is an eye condition, an eye disease that is actually a group of eye diseases.
So it's not one?
It's not one. There are different types that make up glaucoma. And but they have certain things in common. One is that they damage the nerve for vision, which we call optic nerve. And two is that they have a characteristic way of damaging it. And then thirdly is that they also have a characteristic way of showing up in the way they manifest, especially in terms of visual field. Visual field is how well you see the world. Okay, so, and then the fourth is that it is usually a progressive thing. It's a slowly progressive eye pathology. So, and because it's a slowly progressive and painless and symptomless, it will invariably end up in blindness. So when we say it is symptomless, we mean that the person who has it does not have anything to give him a clue that something is going wrong. There's no redness, there's no pain, there's no itching, there's no blurriness of vision, there's nothing. The person is just saying, oh no, I see very well, I don't have any eye problem. So the person thinks, But meanwhile, glaucoma is inside, damaging the nerve for vision. The person is still seeing very well until towards the end of the disease process. That's when it starts touching the central vision. And that's when the person who has it starts noticing that there's a problem. And by that time, when the person notices, there's smoke in my view, up to 95% of the nerves are gone. I don't know if our listeners heard me well. Up to 95% damage has occurred.
It's almost
gone before the person starts noticing that there's some problem in one eye. But meanwhile, about 50 to 60% of our patients come in with blind in one eye because one eye went, they didn't notice. It's when the other one is about to go that they now say, they are now noticing that there's some blurry vision.
So it's possible someone who is listening right now and has lost one eye and not even
not even know. Very, very possible. And it's so important. It happens both to the educated and the uneducated, the city dweller or rural dweller, anybody. Glaucoma is no respecter of persons in terms of choosing a particular person. Okay, it's because you're poor, it's because the only benefit those who have financial access might have is that if they go and have their eyes checked.
Okay, and they can afford the treatment.
Yes, and they can afford the treatment. So the only, but we also know that glaucoma affects the Africans far more than the Caucasians. And actually the Africans are the most affected people by glaucoma. And this glaucoma, because it is symptomless and it gradually damages the nerve for vision, it is called a silent thief of sight. So when someone says, I beg, I'm not going to the hospital, I can see very well, very dangerous statements. You can be seeing very well and 80% of your nerves are gone. So, and the unfortunate thing about it is that the damage caused cannot be reversed. And the damage, and that makes glaucoma the lead cause of irreversible blindness. And so it's not something you want to wish on yourself. If we could operate on it and you start seeing again, then I'm sure maybe we wouldn't be here talking about it. But because damage done cannot be reversed, and then it silently blinds someone. That's why we are here. That's why Solid FM is investing so much in creating in this social responsibility and we are here to talk about it.
Now, each time you talk about the level of impact it has on Africa, a lot of people think it's just gimmicks. I've had people who say it's all the white men. Okay, so why is it that it is Africa that is, so they think it is about this white, black thing and, pushing a narrative that we are the ones affected. So how do you explain that Africa is disproportionately and seriously affected more than other?
We can claim anything, but statistics, are there to prove. So studies have been done in different parts of the world, and the prevalence in Africa is the highest compared to the rest of the world. For instance, the average prevalence of the world glaucoma is 3.5. But in Africa, it is 4.2. And that number we have is actually an average, but that's the average, 4.2. When you come down to the nitty-gritty,
it's probably worse.
It's, yes, like Nigeria, our own is 5.2, 5.02%. In other words, that this percentage of people 40 years and above will have glaucoma. All right, so we have about 3 to 400 million Africans, 40 years and above. So if you check 5% of that, for instance, if you check 4% of that, then that tells you how many people really who have it. And 10% of that would already be blind. Now, and from our own statistics, and we have also seen that glaucoma actually starts earlier in the African. So while if you do studies among the Caucasians, the prevalence of glaucoma less than 40 years old is very insignificant among the in the developed world, but among us it's significant from 30 to 40. Okay, but we don't put in that statistics because everybody did against 40 years old. So we do our own 40 years old. But we have people 30 years and above. And in Ebonyi State, for instance, particularly, we have very young people who have glaucoma. That is, you see them at 20 and they are blind bilaterally, two eyes gone. From glaucoma. So it's a real problem. And well, fortunately, in the past 4-5 years, a study has been done regarding genetics, and because they had done in the developed world, but we hadn't. Africa had not had any glaucoma genetic study done. That's like 5 years ago, and we found out that we have our own glaucoma actually is different from that of the Caucasians, genetically, and that sort of explains why our own starts earlier. It's really not the same type of glaucoma they have on the genetic level. Our own starts earlier, is more aggressive and leads to blindness faster. So so that was a major step. We've done also another study in this time by Africa. The other one we did was by Caucasians in collaboration with Caucasians. Now we have a study that is being published now on that we carried out on our own genetics by ourselves, with their support. I would say with their support, of course, but they supported, but we collected the samples and all that. So so we are still, the analysis, detailed analysis of the genetic thing is still coming out in this recent study, but it's different. And it's, by the time somebody has a family history, the members of that person's family who they are connected by blood, particularly first degree relatives, that's father, mother, siblings, particularly siblings, and then children. The family is 4 to 10 times at greater risk of developing developing glaucoma than other people in the general population.
Yes. Statistics are frightening. Okay, so at what age should Africans begin to worry about glaucoma?
Yes, we say from 30. If you don't have, just go and check. It's sincerely, it costs you very little. And if you tap in during the period of the World Glaucoma Week, which is usually the second week in March, or you tap into the World Sight Day, which is usually the second week in October, you can have a free check every year. Just check. Just check.
It doesn't hurt.
It doesn't hurt. In case it has come in, you can. And if you check this year, it doesn't mean you're certified for life glaucoma free. Check again the following year. Make it an appointment you keep with yourself to preserve your vision.
And how was the last screening?
Yeah, it was good. It was good, though I expected more. I thought that more people would have come.
Okay.
We had maybe a little over 200 people who turned up, but I thought much more for the degree of awareness we created and talked about it, we thought more people would come and, utilize the opportunity.
And so in this case, it wasn't about money because it was free.
It was free. So we have all, as individuals and family members, responsibility to encourage ourselves to have, on one of the sites that we posted the announcements, so a dear brother, Christian brother, posted, and said, just expressing appreciation for this work we're doing, and said that his mother went totally blind from glaucoma, and also his younger brother had glaucoma, is also like 95% blind totally from glaucoma. And then he said that then he himself, sometime last year, we went to check, and his eye pressures were found to be 40 something and 30 something. And because of the family history, the doctor started treating him immediately. And so he went back gave him some medications. When he went back a week after, the pressures had come down. They did to 14, 15. They did some tests and found out that damage hadn't started. The pressures had just gone up. So he was so grateful it was found at that early stage.
So what if it didn't go?
If he did, he wouldn't know. No pain, nothing. And he doesn't know how long he's been on high. He doesn't know. But the important thing, thankfully, was that damage hadn't started. So you can go and check. The pressures might just be high and damage hasn't started. Fantastic. Treatment can be done, and it's like we said, it's usually easier and cheaper to handle at that stage. And if damage has started, it's still early, you can still hold it at that stage. But you wouldn't have lost anything in terms of function. Visual disability is no beans.
It's a very serious thing.
It's a very serious thing.
Is it possible we're seeing more young people diagnosed with glaucoma than before?
Yes, and why I would say yes, apart from what we see in the clinics, I want to give you statistics of the study we did here in Enugu. Now, what we found out was that when glaucoma is going to occur in the children of someone who's had it, it starts like 15 years earlier.
That's to say, let's say it runs in our family.
Yes.
The children, their own get faster. Is that
their
what you're
own
saying?
starts earlier.
Okay.
15 years earlier than so a man was picked to have glaucoma at 70. His child, is picked to have it by 55. It's almost blinding the person. By 40, it's affecting that one's child. If he's going to have it, it starts that earlier. So it only gets younger in a family to start younger. So that's why we're more likely to have a big problem on our hands as time goes on if we don't respond positively to the situation before us.
The part of glaucoma that is a bit disturbing is that it doesn't show early symptoms.
Exactly.
So someone somewhere will be saying, so how do I know? How do I detect it?
You don't want to know that you have glaucoma by yourself.
Okay.
By the time you wait to know by yourself that you have glaucoma, it's gone far, very far. So the way to detect it is to go and have an eye check. So to have your eyes checked by the eye doctor to see whether it is there or not. That's the way to detect it early. But if you want to know by yourself, it is blindness that will be knocking on the door.
Okay. Someone will ask, so can I prevent it?
You can't prevent primary glaucoma. Primary glaucoma, there's primary glaucoma and there's secondary glaucoma. You can prevent secondary glaucoma.
Okay.
Secondary glaucoma are those type of glaucomas that are caused by something. Okay, while the primary ones are the ones that start de novo. You didn't do anything, nothing happened to the eye, they just started by themselves. Now, the primary glaucoma constitutes about 90% of the glaucomas.
90.
Yes, so
Wow.
the secondary one that constitutes about 10%, that's the one you could prevent. So you could prevent something hitting your eye, someone slapping the eye, a football or a tennis ball hitting the eye, some inflammations, reactions in the eye that could lead to glaucoma. You have cataract, you can prevent it from causing glaucoma by not allowing the cataract to stay there and become too bad. So those are things. Also medications, there are some medications like steroids that cause that can lead to secondary glaucoma. You don't use them unprescribed, and if they are prescribed, you use them only for the duration that the doctor prescribed it and not on a continuous basis. So those are ways you can prevent secondary glaucoma, but the majority of the glaucomas you can't prevent them. Yes.
Sorry about that.
Yeah.
Okay. Our people are not very big on checkup, so one will want to know how often should one go for an eye checkup.
Yeah, we've said repeatedly, you could actually go once in 1 to 2 years, but we generally advise make it a yearly thing so you don't forget.
Okay.
Yes, habits are better formed either it's a daily or weekly or 6 monthly or 1 year. 2 yearly one tends to forget, so we say every year check. Every year check, especially once you're 40 and above, every year check, because we are at greater risk as Africans in developing it. And if you're black,
And then if you're a southeasterner.
yes, glaucoma is actually worse in West Africa. And then when you come, particularly Nigeria and Ghana, and when you come to Nigeria, the southeast,
Ndibo.
yes, are at greater risk. And also, in fact, is from the studies done, it's now is a risk factor for developing glaucoma. So we need to do something. We need to help ourselves and not just many times we blame government. Government didn't do this. Government should, but there's so much we can do ourselves. So much we can do. Of course, for instance, government, we are working towards having government integrate glaucoma screening into primary health care, so that out there in the villages, people are trained and they can be able to pick it up earlier. The unfortunate thing about glaucoma is that it's not easy to pick. That is like maybe you just measure somebody's BP, you say, your BP is high. By the time you get a high BP, you repeat it 2-3 times, it's still high. You tell somebody this is hypertension. That is easy to detect. Glaucoma, unfortunately, is not as easy as that. Assuming all glaucomas have raised eye pressure, then that is easy. All you need to do is go through the community, check your pressures. If it's high, you have glaucoma. If it's not, but it's not so. About 30% to 40% of glaucomas have normal eye pressure. And in the southeast, unfortunately, we tend to have more normal pressure than the rest of the country. Yes, our glaucomas tend to have low pressures. In fact, the average now, the normal eye pressure is between 10 and 21. Now, the average eye pressure of our glaucoma patients is 22.
Just slightly high.
Slightly high. Now, the average for the country is 26, 27. And it is the southeast low pressure that brought down the country's own to about that 26. Are you with me? So you get to see more high pressure in other parts of the country.
But Southeast still has the
We
sort
have
of.
low high pressure and damage is going on.
But we have a higher incidence.
Yes, we have higher incidence. So that's why it's not as easy to pick up. So but there are a few things that can be done in the training of primary health workers, so that they can be able to pick it, even if it is not too early, at least when it's gone halfway. There's the place of tele-ophthalmology, where you can also take pictures of the nerve head, and somebody is sitting somewhere in their office and interpreting them and all that. So also the government can also do something about subsidizing
The cost.
yes, the cost of treatment, making eye drops for it more affordable, removing taxes on it, knowing that it's not a luxury item, and if the eye goes, the economic cost
Yeah.
on the individual, the family, the community, and the nation at large is high. So that is very important. And also having insurance coverage for glaucoma. We have a situation where our national health policies are not quite robust yet. It's still serving only a limited amount of people, but it can be made to spread out better, so that people don't have to do out of pocket expenditure, and so they shy away from treatment. And the government can also support in terms of investing in workforce training, and that's those are ways that mobile outreach screenings by hospitals, governments, strengthening data collection system. So those are ways that they can help, to make diagnosis and management of glaucoma, very more approachable. Okay, but then there are things that communities can do. It's always so important when when we know that we can help ourselves. Are we together? We can really, we have capacity. We are not, but when we feel, except government does something, there's nothing we can do. We are helpless. No, we are not helpless. We can do so much for ourselves. As a community, for instance, churches, mosques, if I'll give an example. The Catholic Church, for instance, the congregation, they have high respect for their priests. If the priest should adopt this message and tell his people, say, look, there's a silent blinder, go and have your eyes checked.
Or bring them to the church.
Or you can even make an arrangement once in a year for eye people to come to your church and check people, as part of helping them. The same thing with the Pentecostal churches. You can do that. So gradually the awareness is increasing that check your eyes. You won't believe how many people will be saved. How many people will be saved from blindness. So those are things we can do. Market associations, community meetings. Usually in different communities, they have in the southeast here, Igwe in council, who do something for your people. That a politician wants to give you people something, some bags of rice. Please let him bring eye people to check your eyes, as part of it, because that is a more enduring activity that is sight saving. And then when you have sight, you can do something for yourself. You can work for yourself. So that is what, as community as a community, we can do something. Are you a community leader, either in church or in the market or in your local environment? You can do something to create awareness. This last World Glaucoma Week, we just ended on Saturday, the theme was uniting for a glaucoma-free world. That's it means that we can all do something. Together we win. It's one man does not make a forest, but together we win. And then when you come down to the level of families, what can we do as family members to help fight or prevent glaucoma blindness? If one person is found in the family with glaucoma, that person should announce it round everybody who is related with them. Once there was a commissioner in Ebonyi State who we found that had glaucoma, and he said that he thinks his people have eye problem. Can we come and check his kinsmen? So he gathered them and we went. Amazing. If you see the percentage of people we picked who had glaucoma in that community, it was shocking. So you can do something. You might not be that wealthy, but you have enough, that you can invest in your family. And when you have been picked to have glaucoma, do something for your relatives. Create the awareness. Glaucoma is not an infectious disease or sexually transmitted disease that you might say you feel ashamed to tell people you have it, so they will think where have you been entering?
Where did you sleep?
Yeah, exactly. It's not. It's something that just comes on its own. So there's no shyness. There's nothing to talk about it. To say they found I had glaucoma. And they say if you're related to anybody who has glaucoma, you're at greater risk. Everybody go and check your eyes. Intermittently, have you all checked your eyes? Go and check. So you can do something for your family members. Are you diagnosed glaucoma blind? It's very bad. But you can prevent the next relative from going blind by raising that awareness, by mobilizing, by galvanizing, by helping to even organize the eye care team to come and check your family or bringing them to the hospital. So that's on a family level we can do. We can support each other. We can nudge each other. Go and check. It doesn't cost much. It doesn't take much. Go and check it. Let's be sure so that nobody is blind. Remember, when one gets blind, it's a burden of the family.
On the family, yeah.
Whether you like it or not. So let's do that. Then of course, we as individuals, what can we do? Excuse me.
Sorry.
When you have the risk factors as an individual, what are you waiting for? Go and check. So that if it's there, the scripture tells us, love your neighbor as you love yourself. Are you listening to us out there? Love yourself by ensuring you preserve your vision for life. So go and check. Do you have a family history? Are you of the age? Are you African? Are you black? Do you have diabetes? Do you have hypertension? You might not know whether your eye pressures are high or not. So go and check. So if it's there, the treatment for early glaucoma is simple. If it's not there, thank God, next year you check again. So these are ways we can do, but don't wait for symptoms. That is the old approach. The new approach is get your eyes screened before the symptoms come. The old approach is that I beg is that person's problem, is your personal problem. The new approach now is that it's a shared responsibility.
Yeah.
If you stop seeing, it affects me, it affects the country, it affects your community, it affects your family. It's a shared responsibility. Before it was just a hospital-based care, but now we are centering it as a community-based care. It's there for it's affecting the whole community. Before we always have late identity, the identification, late diagnosis, and treatment. But now we want early detection and prompt and adequate treatment.
If somebody tells you that they're afraid, that's why they don't want to come for check, what will you tell them?
There's nothing to be afraid of. It might be there, it might not be there. So rather than live in fear, just check. If it's not there, then you don't have to carry fear at the back of your heart for many years.
And if it's there?
And if it is there, it's likely early. It's a little treatment can put it in check. So it's wisdom to have it checked.
Welcome back. It's still glaucoma awareness right here on the station The Rocks. And the number to call 0704 550 2840, 0704 550 2840, or 0909 771 1009, 0909 771 1009. We have less than 10 minutes to go. The earlier you make the call, the better, so we can answer you. It happens every Friday, 9 to 10 a.m., and we've been enlightened so far. Hello, good morning.
Good morning.
Yeah, good morning.
This is Philip from Go.
Ndubisi, go ahead.
Please, I want to know how long it takes to carry out
How long it takes to do what?
to carry out the test.
The test.
Yes, how much?
How much?
Yes.
Egone.
Okay.
All right. All right. How much does it take?
To carry out a glaucoma screening test, usually what you require is when you get to a hospital to pay for the consultation to see the doctor. So whatever is the consultation fee, opening card in the place, you do that, and then the doctor examines you. So the major activity the doctor does, initial, is check your eye pressure and examine your nerve for vision, the nerve
Optic
head.
nerve.
Yes, that's the one that the glaucoma damages. So if there is sign that, oh, it looks like damage has started or damage has started, then you'll now be sent for other tests. But if it looks good, your pressure is good, then usually it ends there. So it ends there with the cost of consultation. But except where there is evidence or one can see that it looks like glaucoma has started or definitely has caused damage, then you will now be sent for further tests. So it differs from place to place. That's what we're saying.
There's a time they say it's questionable.
Yes, yeah, queried.
What does that exactly mean?
It's suspicious.
Suspicious.
Yes. So sometimes when you examine the optic nerve head, it's looking like glaucoma is starting, but it's not yet definite. So you could now be labeled as glaucoma suspect.
Okay.
Yeah. So like I mentioned earlier, the eye pressures normal is between 10 and 21. Occasionally you might also have raised eye pressure, and but it's not too high, but it's higher than normal. So, and then you look, the disc could be looking a bit suspicious, but if the disc looks good and the pressure is higher than normal, we call it ocular hypertension. Yeah, so it's
So if it's suspicious,
suspicious, yes, and then if it's suspicious and then you have other risk factors, then one would want to investigate it a bit further.
Okay, let's take this call. Hello?
Good morning.
Yeah, good morning.
I'm
What's
calling
your,
from Enu.
what's your name?
Chichi Great.
Ah?
Chichi Great.
Chichi Great, okay. So go ahead, talk to Prof.
Prof, I just want to appreciate you people I went for the free screening test,
Okay.
and then I was not detected
Thank God.
to have glaucoma. My pressure was 15/19.
1519, okay.
16,
Slightly,
yes.
okay.
So, but my question is then, well, after giving me the eye drop that I should put, they didn't tell me the number of drops I should put in each of my eyes.
Okay. Any eye drop, one drop, once it has entered, is good enough. One drop is good enough once it
One
has
drop.
entered. One drop.
Did you hear? Okay, I think she's gone already.
Okay.
Are you still there? Hello, Chichi Great. Okay, let's blame it on
Yeah.
network.
So usually one drop is what you need.
Okay, one drop.
Yes. Yes. Once it enters, it's sufficient. Yeah.
Okay.
For-
All right, the
for-
talk lines are still open. We can take a few more calls. 0909 771 1009. If you were at the screening, you can also call and let us know in a few minutes what your experience is like. 0704 550 2840. Hello, good morning.
Hello, good morning.
Yeah, good morning.
The seven to be sick from the world.
Andy is back. Okay, go ahead.
Please, these tears that are coming from the eyes, is the seven tears that is causing the pressure of the eye to the eye.
Okay.
Because at times you see many tears coming out from somebody's eye. Is this signifying that it's kind of tumor or blockage of the outlet? Please, I want to know.
Okay.
Okay. You got his question.
Yeah, I got his
Okay,
question.
go ahead.
Yeah. Yeah, it's not that tears, because we talk about fluid inside the eye in glaucoma, fluid produced inside the eye, and we get to go, and if a channel it goes through is not open well, then the pressures begin to go high. That fluid is different from the tears. The tears we have is external, just on top of the eye. The fluid that has to do with glaucoma is inside the eye. It doesn't come out. So these eye tears you're having is a different thing. It's usually from what we call dry eyes. So it's different.
Okay. All right. In the absence of any other call, let's quickly end by talking about the treatment options available in Nigeria.
Okay. Usually there are three major methods of treatment. We have medications, we have laser, we have surgery. And under surgery, there are different types of surgery too. And I would like to say that the three types of ways of treating glaucoma that they are available in the country. It's just that some of them are not widely available. Okay, but medications are the most widely available, followed by surgery, then followed by laser.
Okay, let's take this last call.
Hello.
Hello?
Hello, good morning.
Good morning.
Good morning, Prof.
Good morning.
Go ahead quickly. We're almost out of time.
Okay, it's OWGIG from Amoji.
Okay.
I called last Friday, yes. So, I want to ask a particular question. Why is it that the Southeast is at risk higher than other places? Is it because of the kind of food that we eat?
Okay. All right.
And secondly, I've not seen my airtime.
I'll send it to you.
All right, sir. Thank you very much.
All right. Go ahead.
Thank you very much for the question. Yeah, it's not because of the food we eat, because in the study done, wherever we found Southeasterners, the prevalence was high amongst them, irrespective. So it didn't matter whether they were in the north, in the south, or in the east. So it's more of a genetic thing. We are looking forward to and hoping we can have a particular study done to identify maybe what exactly is different amongst our own people, why it's more prevalent amongst us. I don't know if I missed any other question of his.
No, that's just his question.
Okay.
All right, thank you, Professor Nkiru Kizakariwe. Thank you for the enlightenment and all you do to push this awareness. And we're hoping that we'll get more responses from people. If you have not checked, go and check. It doesn't hurt to check, so that you don't check and you're almost blind. I mean, if it is there, the possibility is there. I mean, somebody just called in to say she went and she was told she doesn't have it. So there are only two things that can happen. You either have it or you don't have it. The last time I went, they said mine was suspicious. So I will follow it up
and keep checking. So
if it eventually is glaucoma,
at least
I'm fine.
It's early.
If it's detected early, I'll start the regimen. I mean, it's not a death sentence, especially if you detect it early. And hopefully we'll be bringing in some other people to tell their story. If you're a glaucoma patient and you're listening to us, we'll also want to capture your story. Your story will help other people who have not been diagnosed to get better. All right, until next week when we bring you another edition, thank you for being part of this awareness program.